What is mSMART?
So mSMART is Mayo's consensus-driven risk-adapted therapy recommendations. So those are found at mSMART.org. And we provide for physicians that don't care for many patients with multiple myeloma an outline of how we would treat a patient with multiple myeloma at diagnosis, including risk stratification, how we would treat them at the first recurrence, where we place stem cell transplant in management, as well as how we manage patients when the disease comes back second, third, and fourth time. Since mSMART has been introduced 12 years ago, it's had over 1 million hits, and it's an extremely popular website for physicians that specialize in cancer treatment but don't specialize in multiple myeloma to go to mSMART.org and get Mayo Clinic's recommendations for the treatment of multiple myeloma, what testing should be done, which patients with smoldering should be considered for treatment, and how we sequence therapies in the disease. And you'll find that at mSMART.org.
How does mSMART stratify for risk?
We do this in a number of ways. The actual international stage is important. The presence of features such as extramedullary disease, multiple myeloma that is outside of the bone marrow. But most importantly, we look at the genetics of the myeloma cell. And when I say genetics, I don't mean that this is inherited. I mean that the cancerous cell acquires mutations that predict its biologic behavior. And we can use those genetic changes to get a prediction of risk of myeloma getting worse or showing a shortened response to chemotherapy. And we'll use that to drive our decision-making process with regard to selection of appropriate therapies, or in many instances, an appropriate research clinical trial that a patient should be participating in order to get the latest treatment that would be effective for the management of their myeloma.